Shares of Bristol Myers Squibb are falling as much as 8% today, or more than 8%, after rival Merck made significant advances with its lung cancer drug. Joining us now with more is Taylor Riggs. Taylor.
So it's just the horse race, right, between these two lung cancer drugs. Who's sort of getting ahead? Who's sort of falling behind? In this case, Bristol Myers is falling a little bit behind in Opdivo, its lung cancer drug, relative to Merck, who has Keytruda, which made some significant advances today. And if you come into my terminal, GTV Go, you can see just by the share price alone the difference in these two, how investors are feeling about Merck in green and then Bristol Myers in red. Now, they did a presentation at the American Association for Cancer Research today, and Merck's Keytruda, combined with chemotherapy, had a, quote, practice-changing result. Bristol Myers had a good result, but sort of left out some of the specifics. And so analysts were sort of questioning sort of how much progress they now need to make to sort of leapfrog and catch up to Merck. When we look at Opdivo and what it means to Bristol Myers, it now makes up 29% of its sales. But interestingly enough, this year, it will go from number one to number two. They have another drug in their pipeline that's sort of outpacing it. So you get this sense that they're sort of falling behind in this race. Some analysts said that halfway through this latest study, they changed their study to really focus on a certain sort of advanced tumor. The skeptics are saying, if you change it halfway through, are you doing that to make your results better? Some were saying, well, maybe they did that so they could really have a niche. Maybe this will be sort of where they target to get ahead. So some questions outstanding, at least from the analyst perspective.
Yeah, and of course, quite from the markets, this is terribly important to cancer patients because lung cancer has such a high mortality rate as a practical matter. But how important is this, on the other hand, to Merck? Every time we do an earnings call, they mention Keytruda.
Yes. Grossly important, makes up about 20% of their sales. And we have a chart showing how that has just skyrocketed. It was like 8% of sales even just a few years ago. And so Keytruda really is important. And that's when they got the results today. In NYU, Langone Health Associate Professor came out and said this is changing, that the survival rate really picks up with this drug combined with chemotherapy. And you had a Credit Suisse analyst saying if all goes well, they could get 3 to 5% now of the market.